Herzlich willkommen zu einer weiteren Montagskonferenz im Wintersemester 2024-25, die dem Rahmenthema Money, 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 regiert Geld, die Welt gewidmet ist. Wir haben heute zu Gast bei uns Professor Dr. Anca Balietti. Sie ist seit 2018 Professorin für Wirtschaftswissenschaften am Alfred-Weber-Institut der Universität Heidelberg. Davor hat sie einen Postdoc an der Harvard Kennedy School verbracht und dort geforscht. Und ihre beeindruckende Vita kann man entweder in Kürze hoffentlich auf unserer Homepage oder auf ihrer eigenen Homepage nachlesen. Ihr Thema, das sie uns heute mitgebracht hat, ist The Role of Beliefs in Shaping Preferences for Environmental Action. Sie wird uns selber gleich erläutern, worin diese Forschung genau besteht, aber es sei noch angemerkt, dass sie auch in sehr unterschiedlichen Themenbereichen geforscht hat, wie zum Beispiel Traber Types and Volatility of Emission Allowance Prices oder zum Thema Air Pollution and Child Development in India. Darauf würde ich auch gerne in der Diskussion noch eingehen. Aber jetzt übergebe ich das Wort an unsere Rednerin. Wunderbar, dass Sie gekommen sind.
Hi everyone, thank you for having me here. It's my pleasure today to discuss with you my work. I'm an environmental economist, and what environmental economists do or try to do is to take estimates from environmental scientists of how bad different environmental problems are around the world and translate those estimates into policies. So what we want to do usually is to inform policy by governments how to take into account the results of scientific research by environmental scientists. And what I would like to talk to you about today is specifically this estimate that environmental scientists create and that we as environmental economists try to bring to the government, to the public. And what I try to answer in my work is why still, despite so much evidence on the negative consequences of climate change, the health impacts of air pollution and so on, we still see very little progress in this direction. And my work, one of the points that I try to highlight in my work is that people don't take these estimates from environmental scientists and so on accurately. They don't trust them, or they do not update their beliefs, their own perceptions directly. This is why we have these beliefs in the title of my talk. It's how people interpret and what kind of beliefs they form about scientific information. Because in the end, what the population will do is not necessarily to act according to what the scientists say or what they estimate, but what people in the end choose to believe. And we will see that in many cases, what people choose to believe is actually different than the scientific truth that is out there. And with this, I don't say that this is always the case, but a part of my work is to show that this kind of different beliefs can modify environmental action in that sense. And I will give you now 3 examples of areas of research projects that I lead where beliefs play an important role. The first one is about information and how information itself, despite the fact that it's just information, can create emotions. And people will react according to these emotions, sometimes not believing the information that is presented to them. And a large part of my work centers around the health effects of air pollution. And what I ask in this first project is whether or not and to what extent do people ignore the health effects of air pollution. And if some people do ignore the health effects of air pollution, what can explain it? And what we show in this project is that at least to some extent, our own belief about how we can modify outcomes, how can we modify these health impacts of air pollution, can explain some of this strategic ignorance of information. The second project I work on, I will not have much time to talk about it today, but I'm happy to guide you through it if you have questions at the end, is the inequalities that air pollution consequences create. We are all exposed to air pollution, more or less, but we don't suffer from it equally. And an important factor that mediates how we are affected by air pollution is our income level. Richer people are, first of all, less exposed to air pollution. On the other hand, they also have less financial means to deal with the health consequences of air pollution. They have less access to go to the doctor. They have less money to pay for the best care and so on. And what I study in this second project is whether or not this idea of how rich I am relative to others impacts my beliefs about how much myself I'm impacted about air pollution. And if I'm relatively richer and I think that I'm less impacted, will I be more or less willing to do something against air pollution? Will I feel some sort of responsibility because I have the financial means to do something against air pollution? Or on the contrary, if I'm richer and I think I'm less impacted by air pollution, will I do less because it's not my problem that much anymore? And what we show in this paper, in this project, is that it's a bit of a combination, a trade-off between these two forces that comes into play. Finally, the third project I wanted to briefly talk about is how people perceive the threats of climate change. We know that around the world, despite scientific consensus on climate change and the consequences of climate change, many people are still skeptical. And what we study in this project specifically is how people react to everyday, actual news articles about climate change. In particular, how do climate skeptics view these articles? Do they neglect them altogether? Do they become even more against climate change? Or what is happening? And we also try to see what others predict that skeptics will do. Are skeptics themselves better at predicting the impact on skeptics, or the contrary? Are people that do believe in climate change more likely to be able to predict well what climate change deniers will say after reading this scientific news about climate change? Okay, so with this three projects in mind, what I can do today is to go more in depth into the first one. I think it's also the one into which I put a lot of effort, because it combines a lot insights from psychology with insights from development economics and economics in general. The project is called Strategic Ignorance of Information and Perceived Control, and this work is joined with my colleagues Angelika Budian from the University of Stuttgart, Tilman Aimes from Stockholm University, and Ali Soldat, who is at the University of Lyon. And again, the overarching theme in this project is air pollution. Air pollution, as you probably know, refers to the chemical mix that is toxic in the air and that poses health and environmental risks. Air pollution comes from many different sources. What we see here in the figure is, first of all, the largest image represents pollution, air pollution coming from industries, and it's true that they represent a major factor in the release of air pollution, but they are not the only ones. Especially in cities, in urban areas, the major sources of air pollution is car traffic. So every one of us, whenever we ride a car, we contribute to the air pollution in our town, and so on. We see also two pictures of air pollution generated by agriculture, forest fires, and the clearing of land for agricultural purposes. Especially in developing countries, whenever people want to clear the land, to cut the forest, to make that land available for agriculture, they burn the forest, or they burn whatever is on the land. This in itself releases large amounts of air pollution that are very toxic for the health of the population nearby. But because air pollution travels, it doesn't stay in the source, in the location where it's generated, it impacts populations even very far away. There are many consequences, many bad consequences of air pollution. The most prominent ones that we always hear about are the health effects of air pollution. It increases in particular respiratory and cardiovascular diseases. It's very similar to smoking. If you live in a very polluted environment, it's like being a very heavy smoker. Beyond respiratory and cardiovascular diseases, it can also impact directly the cognitive function of the brain, and it harms children especially from the beginning of their lives. In particular, children and the elderly are the most affected by air pollution due to the situation of their immune system at that point in time. Beyond the health effects, we do have very large environmental damage from air pollution, because air pollution by itself also contributes to climate change, and it contributes to the degradation of very many different environmental sites. For example, it reduces biodiversity. We care about air pollution also because it has direct economic costs. If people are sick, they need to pay for the doctor. So there are very large health costs involved, healthcare costs involved. At the same time, sick people are less able to work well. So we have direct productivity losses from this. And finally, air pollution, as I was trying to mention in the other projects, contributes to social inequalities. We are not equally affected by air pollution, and so air pollution in itself creates or contributes to this social inequality by affecting different people in different manners. We can quantify, maybe not all of the effects of air pollution, but what we can quantify at least is across the globe, what is the role of air pollution in reducing lifetime expectancy. And what you see here is a map of the world created by scientists at the University of Chicago, where they take the air pollution measurements from all across the globe at very fine resolution, and they compute how much that air pollution concentrations contribute to reducing life expectancy. So as you see, the colors here are from white, or light yellow, going to dark red. The darker the color, the higher the loss in life expectancy because of air pollution. And what you see here is that most of the reductions in life expectancy are mostly present in the southern hemisphere of the globe. But not only there. We see, for example, in Europe, colors ranging from yellow to dark yellow. On average, in Europe, we lose around 1 year of life because of air pollution, but this varies a lot depending on the location. The areas that have highest pollution and highest life expectancy loss in Europe are usually northern Italy and the east of Poland, because of the pollution sources that are located in each of these places. But again, as I mentioned, pollution doesn't stay there where it's created. It moves around the entire continent. We will see this figure again during my talk, because I will tell you where we do the studies that we do. We cannot have, unfortunately, information from around the globe, but we have 2 locations, and I will come back to those. Now, despite the fact that air pollution is so costly to all of us, we see quite little action, environmental action, and this is especially true in developing countries. And there are a combination of reasons why this is so. In developing countries, we have in general a lack of policy enforcement. Environmental laws are defined across most of the world. So the laws are there and are in place for environmental protection. What is more challenging in developing countries is how do you enforce those laws? How do you monitor and make sure that the laws are actually implemented? This is, of course, very costly. If you need to monitor all of the polluters across the world or across the country, it's very, very costly for the governments. And the burden is even higher in developing countries where the governmental budget is lower. So in this way, you can understand why enforcement is lower in these settings. Secondly, we also have what we call inadequate public awareness. Not everyone is informed about the negative health consequences of air pollution. And of course, if you are not aware of the consequences, you're less likely to demand policy changes. Moreover, not only that people are not aware of the negative health consequences of air pollution, but they are also maybe not aware about how to protect themselves. It happens that in many cases, especially again in developing countries, people don't know that wearing a face mask or buying an air purifier can significantly reduce the impacts of air pollution on your own health. And thirdly, very much limited to this public awareness, is that we see, especially in the developing countries, that many people do not adopt protection measures, despite the fact that it's there where air pollution levels are the highest and the health impacts are the highest. Of course, I will not be able, and my research in general is not able to comprehensively look at all of these channels. But what I focus most on in my work is this third point, where people insufficiently adopt protective measures. And I look into what? And coming back to the motivation that I mentioned at the beginning in the title is what I look at specifically is whether or not some people ignore actually the information about these health risks that air pollution poses. So now I will try to convince you why it makes sense sometimes to ignore the health risks of air pollution or to ignore information that we don't like. And I will start with how this is viewed in standard economic theory. Information has value in standard economic theory as long as it can improve decision making. So in this sense, the value of information is never negative. It can either help you make better decisions, then it has positive value, or it doesn't change your decisions and it has no value. But under this framework, there is no reason for you to avoid information, strategically avoid information, because information cannot harm you. However, with the influence of psychology, behavioral economics in the last decades acknowledges the fact that information, beyond this usefulness it has for decision making, it also has affective value. We have emotions when we hear different types of information. There is information we like and information we don't like. And if the information we don't like has a really negative affective value, it can lead us to avoid the information altogether, to try to ignore it. And we have some examples here, not from my own work, but examples very well established in the literature, where people avoid the information about the specific risks. How this theory of information avoidance has been developed from the beginning was mostly related to the results of genetic health tests. It's well known, well documented that people at risk of developing genetic disorders are less likely to take tests for those diseases. And how the literature tries to explain this is that knowing the result of the test can be very, very distressing information to the people. So people avoid on purpose taking the test to not find out bad news. Similarly, we can maybe remember the times of COVID, when we were bombarded with information about COVID cases around the country and the different measures that we had to take to protect ourselves. And probably for all of us, it was at least a bit anxiety-inducing reading and being exposed to all this news, despite the fact that the news itself was very useful for us to know how to protect ourselves. Similarly, with climate change, despite the consequences, many people don't want to hear anything about climate change. They don't want to read news about the consequences of climate change, how this will impact our future, and so on, despite the fact that this information should be very useful for us to know how to adapt, how to protect, and how to demand more action. So in general, in behavioral theory, how we view information is as a trade-off between the usefulness of information and this emotion that it creates. In my work, because I work a lot with air pollution, I consider air pollution information to be anxiety-inducing. So people will take into account information about the health risks of air pollution if the anxiety this information creates will not surpass the usefulness they find from this information. So what I ask, again, is whether or not people decide to ignore, purposefully ignore information about the health costs of air pollution. And secondly, if increasing perceived control can reduce the strategic ignorance of information. What I mean by perceived control is a belief that each one of us holds that we can modify or we can control the outcome. If we think that air pollution is there and is very harmful for us, but we think there is nothing I can do about it, I might just as well ignore the information because it's doing nothing else than stressing me out, but I don't have the means to do so. But maybe once you give me the tools to know how to protect myself against air pollution, will I be more likely to engage with this information, to recognize the risk and to do something about the risk? That's the research questions that we are asking. And now a little bit about the method. How do we go about answering these research questions? What we use is what is actually called survey experiments. So these are questionnaires applied to many people, to a large group of people. And we call them experiments because what we do is to split the sample of people in two in a random way. So we randomize who gets different information. And at the end, we measure whether or not the information that we gave randomly to the subset will change the behavior of that group relative to the group that hasn't received the information, which this group we call the control group. The distressing information the experiment is framed about is this life expectancy loss because of air pollution. First of all, because it is anxiety-inducing. Thinking about how many years of life because of air pollution, I don't think it's a pleasant exercise for anyone. And we know from the literature that especially health information is prone to being avoided. First of all, it's a very policy-relevant area. Air pollution, as I was arguing earlier, costs millions of lives across the globe yearly. So we should want to do something about it. And third of all, because in this area, there is room to increase perceived control. Many people believe that there is nothing we can do about air pollution, that air pollution is uncontrollable. The impact it has on us, nothing can change them. But actually, this is not true. There are many things we can do to protect ourselves against air pollution, and in many cases, these measures are really cost-effective. So they don't cost much, they don't involve large changes in behavior, but they can protect us a lot. We measure two types of ignorance of information. We call this information avoidance. So do I want to be exposed to information or not? Do I want to even read the information, or from the beginning, I just don't want to hear the news? And secondly, we look at information forgetting. So if I have received the information with my will or against my will I remember it shortly afterwards? For the remaining of the talk, I will talk about this survey, how we designed it, how did we manipulate perceived control to be able to evaluate the impacts of increasing perceived control. I will show you the results, and I will then also comment on the external validity of these findings. Do we believe that the findings that we measure in the first location where we run these survey experiments can be applied in other settings or not? So going back to the map of how many years of life we lose because of air pollution, what you see here is that the poster child on this map is India. And in India, air pollution doesn't affect everyone equally. The impact of air pollution on life expectancy varies from a bit less than a year in the south of India, on the coastal areas, to up to 12 years in the north. So people in India lose, on average, in some parts of India, 12 years of life just because of air pollution. I think you agree with me that this is anxiety-inducing in terms of information. At the same time, it should also be very useful, because if you live in that area, you'd better do something against it and not just neglect the risk. So for this experiment in India, we collected data at the end of 2022, and we have a sample of about 2,000 respondents from all across India. We survey people randomly from 33 states, out of India's 36 states and union territories. So we cover most of the territory. And this gives us a sample that receives information or can receive information about the life expectancy loss of air pollution that on average amounts to about 5.8 years of life. So on average in our sample, people lose 5.8 years of life because of air pollution. But as I told you, because of these large geographic differences, some people could receive information that they only lose 1 year, while others could be confronted with information that they lose up to 12 years of life because of air pollution. How does the survey look like? How did we organize it? At the beginning, we just have a short demographic survey where we ask people their age, their income, their gender, and specifically important for us, their location, the state where they are coming from. And then we give everyone in the survey, it's an online survey, we give everyone information on air pollution, what air pollution is, what sources create air pollution, what are the main consequences of air pollution, and so on. We do this because we want to bring everyone more or less in this sample on the same page. They might start with very different ideas about what air pollution is. They might not be informed at all. We want to at least have some basic common knowledge for everyone. After this, we ask everyone what do they think about the air quality levels in their area. And here they don't need to tell us any kind of scientific number or anything. We just ask them on a qualitative scale. Do you think that the air quality in your state, in your region, is very clean, not so clean, or very dirty? So this is just a qualitative assessment that they make. After this, so these 3 steps are confronted by the entire sample. In step 4, what we do is this randomization into the treatment and the control group. So out of these 2,000 people in our sample, we randomly select half of them to be in the control group and half of them to be in the treatment group. And those in the control group don't do anything at this stage. Just in the treatment group, what we do is to try to increase their perceived control over the consequences of air pollution. And how do we do that is with an example screen, as you see here. We tell them a list of 8 actions they can take to protect themselves against air pollution. 4 of these actions are outdoors, things they can do outdoors, and 4 of them are activities they can do at home. In general, they are really inexpensive activities like wearing a face mask or ventilating when outside is not too polluted, avoiding high congestion areas, and so on. And then, because we want them to remember, to engage with this information, they need to summarize it in the box below. What did you read in the box above? Just for us to make sure that they read the contents of this information box. And just remember that this is seen just by our treatment group, so not by everyone. After this treatment variation, everybody in our sample is asked, what do they prefer? Would they like to receive information about how much, on average, people living in the same district as themselves lose in terms of life expectancy because of air pollution or not? And this is a choice, so they can freely choose one or the other. It doesn't cost them anything to either say that they prefer not to receive the information or that they would like to receive the information about the average life expectancy loss in their own district. Now, what participants know, and what is true in this case, is that whatever they click there will not be implemented one-to-one, but it will be implemented only with a 60% probability. 60% is because their preferred answer still has higher chances of being implemented, so they should answer in line with their preferred choice, but there is an element of randomness. They might or might not receive this information later on. Why do we do this? Is because we want to show this information to both people that wanted to see it and people that did not want to see it, such that later on we are able to measure who can recall the information. Remember that our second measure, information ignorance, is whether or not seeing the information actually means that you will remember it or not. And we didn't want to have just people that wanted to see the information being asked if they remembered it, because those will be the people in general that are mostly motivated to see this. We wanted to mimic also the situation where you might not have wanted to hear the news, but you were exposed to it anyway. Will you then remember this information or not? So after they answer yes or no, do they want to see the information or not, they are randomized by the computer to see it or not. And if they have been randomized to see the information, they get such a screen. In this case, the participant was from Kolkata, and they can see the map of their own district and learn how much their own life is on average shorter because of air pollution. For somebody from Kolkata, this is 7.8 years of life. They live 7.8 years of life less just because of air pollution. After this information is displayed to them, so both to the people that are in the treatment group that received this list of how to protect themselves against air pollution and the control group that hasn't received this list, everybody feels, we have an exercise for 2 minutes that is unrelated. They just need to count coins in a table just to pass the time for 2 minutes. And after these 2 minutes, everyone that has been randomized to see this information is asked whether or not they can remember the number. Do you remember what we told you? So in the example of Kolkata, how many years does a person from Kolkata lose on average because of air pollution? If you tell us the correct answer, we pay you money, because we wanted them to have an incentive to work on these tasks accurately, so to want to give us the correct answer. And at the end, so they are allowed to make, so they need to give the answer, they need to put the correct number on the slider that you see here, but we give them an error margin of plus minus half a year. So in the example of Calcutta, it was 7.8 years. It doesn't need to be 7.8. It can be a bit or higher or lower. They will still receive the money, because what we cared about is that they remembered something around the correct number, not necessarily the absolute correct number. And finally, we elicit basically the perceived control. We ask a series of 8 questions where we try to understand how much in control do they feel with respect to air pollution. Can they do do they feel that they can do something to control the impacts of air pollution on their own health or not? So now let's look at the results to see what we find out from this study. The first thing I will show you is this histogram of perceived control. So these are the answers to these 8 questions of how much do they feel in charge of their own health with respect to air pollution. What you have in dark gray is this treatment group that has received the list of things they can do to protect themselves against air pollution. And what you have in light gray is the control group who hasn't received this list. And what we see here is that in general, the distribution shifts to the right. It means that the people that receive the lists of things they can do against air pollution, they feel more in control of the effects of air pollution on their own lives. This is exactly what we wanted, to shift their perception of how much they can control air pollution. Now we look at information avoidance. Who wanted to avoid the information? What % of this sample of 2,000 people wanted to receive information about the health costs of air pollution and who didn't? What we find here is that both in the treatment and in the control group, only about 9% of all participants didn't want to receive this information. So we have a very large share of people that wanted to see the information. They wanted to know how much they are impacted by air pollution. And now we look at, do they remember? So most of them wanted to see the information. Do they remember this information 2 minutes later? It's what you see here is the share of participants that forgot the information 2 minutes later. So if you remember, we pay them to tell us the number. Around 27% of the respondents in the control group are not able to remember the number 2 minutes later. While in the treatment group, so the people that have a higher perceived control, the share of forgetters of information, the people that ignore the information through forgetting, is significantly reduced. We bring this to below 20%. So it's not that with increasing perceived control, with what we did, we completely erased the share of people that forget it, but we did manage to reduce it significantly. And now we ask ourselves, but did they forget on purpose? Did they just neglect the information because they were not interested in it, or was this somehow strategic? Were they motivated? Did they actually wanted to forget the information because this information was, as I was saying at the beginning, potentially anxiety-inducing? And to try to get an answer to this question, what we do is to look at the prior beliefs of participants. If you remember in the questionnaire, we asked them before anything, what did they think, how bad is air pollution in the region where they live on this qualitative measure? Because the theory is that those that are most optimistic about how good the quality of air is in their region, for those, the news of life expectancy loss will be the worst, because for them it's unexpected. What they hear is unexpected. It contradicts their prior belief that air quality is good. So is it these people that for whom the information was most anxiety-inducing, and who would have highest reasons to actually forget the information? That's our theory. Now we look if that's actually what is going on in the sample. And what you see here is these pre-existing beliefs that people have. So in the first diagram on your left, this is the distribution of these prior beliefs. How much do they think they live in an area with clean air or very dirty air? And we are in India. We know there is variation in air pollution. You see there is very large variation in these prior beliefs. Some people are very optimistic. They think they live in an area with very, very clean air, excellent air. Some other people are on the opposite. They are pessimistic. They chose the answer that air quality is the worst in their region, and a lot of people in the middle. What is also very interesting in this prior beliefs is the confidence that people have in these prior beliefs. This is the graph in the middle that I'm showing you here. They are asked, so after they say how they think, how bad air pollution is in their own district, we ask them how confident they are in this answer. And this confidence is measured on a scale from 1 to 5. So where 1, you're not confident at all, you basically don't know, and 5, you're very confident. And what is interesting here is that people are very confident about their prior beliefs. They think they really know how bad or how good the air quality is in their region. And this is specifically the case for the most optimistic and the most pessimistic. That's why we see this U-shape. Those that believe to live in a very, very clean area are those that are also very confident that they live in a very clean area. And the same for the pessimists. Now, because we do have this variation, so not everybody in our sample is exposed to the same level of pollution, we look, are these prior beliefs actually informed by what is actually going on? And this is what we see in this third figure here on the right, where we see there is some variation. So if you compare their beliefs with what is actually going on, it's true that the pessimists are those that live in the areas with the highest pollution. This is the large bars on your right. The pessimists lose on average 8 years of life because of air pollution. The optimists, they still lose 6 years of life because of air pollution, but they consider this to be very good air. And what is interesting here is that there is actually no difference between these very optimistic people and the people that are more in the middle. So they all more or less lose 6 years of life because of air pollution, but they have very different expectations. Some of these people think they live in very clean areas, and some people think they live in very polluted areas. And now let's see who has more incentives to forget. The optimists, the pessimists, or the people in the middle. And this is what we are looking at here. What you see on the left, this is the average in the control group. So these people that have not seen the list of things they can do against air pollution. And we see that optimists, this blue line, 60% of these optimists forget the number we told them about the health costs of air pollution 2 minutes later. And this is very different than the other groups. So it's these optimists for whom the news was most unexpected, and if you want, most distressing, because it's news they were really confident they are gonna learn that they live in a very good area. That's what they told us, area with very clean air, but they receive very bad news. They receive very bad news, and what do? 60% of them forget 2 minutes later how bad the air is. So this goes back to this trade-off at the beginning that I was discussing with the anxiety-inducing and the usefulness of information. The information should be mostly useful for these people because they are the most unaware of how bad the air pollution is in their area. But it's them for whom anxiety is the largest when they receive these unexpected bad news, and they are the ones that are most likely to forget it. And now what we see on the right-hand side is the difference between the treatment and the control group. So us increasing their perceived control, giving them this list of things they can do against air pollution, how does it modify this forgetting of information? And we see that the treatment works. For these people, the optimists, that were most likely to ignore the information, to forget it 2 minutes later, they are less likely to forget it if they see in this list of things they can do against air pollution, if they can feel more empowered against air pollution. Now, I promised you to, so most of my talk now was about India and the Indian sample. And as we've seen here, India is a bit of a special case because of just these very large values of air pollution. And the question is this a result that is just characteristic for India, where the air pollution is so bad and the life costs of air pollution are so high? Or can we extrapolate this to other regions. And so to try to answer this question of external validity, what we do is to do exactly the same experiment, but instead of using the population from India, we draw a sample of 2,000 people from the United States. If you look at the United States, you see that the situation is very different than what is in India. The colors are much lower, the shades are much lighter, because air pollution in the US, although it causes thousands of deaths annually, it's not really comparable to the Indian level. So the question is, do our results hold in this very different context, where air pollution is a lower threat, although it still costs so many lives yearly? So we have again a sample of about 2,000 participants from the US. We don't gather people from all over the states, because you see what you look at here is that a lot of the US map is white. So there the air pollution cost would be zero. It's not very interesting for us to do an experiment with that. We take these states where they have some yellow in them, where the information is negative, then the news are bad. So we take the 10 most polluted states, and again the situation is very different from India. If you remember the Indian average being at 5.8, in the US that's 0.5 years of life, mostly similar to Europe, to the European context. For some people this means just 0.1 years of life because of air pollution. The most is 1.5 years of life because of air pollution in the US. And now this is the figure of the result. And I think I can convince you that it looks quite similar to what we've seen in the case of India. We have again a sample of optimists and a sample of pessimists. Who's going to forget the information? The people that are mostly optimistic at the beginning. Those that expect to live in very, very clean areas, but receive information that the air quality conditions under which they live has health consequences for them. The bad news, the same as in the India case, is not fully integrated. 60% again of these people forget it 2 minutes later. And again, what we see is that this positive, the good news effect, that increasing people's perceived control, letting them know what they can do against air pollution, making them feel more empowered about the effects of air pollution on their lives, makes them less likely to forget. So let me just summarize what we've discussed today, what I've covered. And it starts from the premise that we as scientists, we are very much concerned with estimating the risks, with estimating the most accurate impact of climate change, of air pollution, and so on. But we should not neglect the fact that the most accurate estimates might be neglected. If people feel not empowered, that they cannot act upon these risks, it doesn't matter what we estimate, they will just ignore the risks. So what my research tried to do is to try to put emphasis on the fact that you need to pair this information on the health risks or the economic risks with empowering the people to know how to protect themselves, how to deal with those risks. I looked here, the project that I discussed today was about air pollution and increasing perceived control. And we've seen that many people, they are willing to look at the information. There was not much information avoidance in my sample. But once they look at it, if they don't like it, people forget the information, and they do so very fast. But we do have this tool. We can empower them to do something against the risk. And this will make them more likely to acknowledge the risk, to remember the risk to start with. Now, what is the policy relevance of these studies? As I said, I think it teaches us something about how do we communicate risks. We need to make sure that people are ready to engage with these risks, and that the risks are not communicated in a way that is just anxiety-inducing, because then we will forget it. We will not want to act upon it. Now, what we didn't measure in this study is what do people do with this information? They remember the information, and then what? Do they actually change their behavior? And this is, I think, a very interesting area for future research. If now I can remember the risks, and I know the risks, will I demand action, different policies from the government, from the regulators? Will I myself be more willing to change my lifestyle, to do something against those risks? And this is something that this current research doesn't answer, but on which I'm working on at the moment to try to answer this kind of questions. Because in the end, what we care about is how people use this information, not only if they remember the information or not. Okay, I think I'm done with my talk. I don't know how fast I've been. Thank you for the attention. You can read about these different projects on my website, and if you have other questions, you're welcome to email me about that.